Hello, this is
Hello,
Dr. Lyn Patrick.
Lyn Patrick.
I am going to give you a little preview of a course that Dr. Misha Cohen and I are teaching on chronic hepatitis C integrated treatment using both TCM and naturopathic medicine. So tonight, or this presentation, I'm going to be talking a little bit about nutritional intervention, both with supplements and botanicals for chronic hepatitis C. Weight loss is very important. There's a lot of documented information in the medical literature about the necessity of weight loss, especially if patients are going to be going on standard treatment. So they're, if you have patients that come to you and they want help getting through standard interferon, ribavirin, and now the direct-acting antivirals for treatment of their chronic hepatitis C, having them go on a weight loss plan before they start treatment, particularly if their body mass index is above 25. That's the ideal. That's what we want, is to get people down to a body mass index of 25. But even as little as 7% of their total body weight, losing that before they start treatment significantly increases their ability to get through standard treatment and have a sustained viral response. What a sustained viral response means is that they actually have cleared virus at the end of their treatment period, and there's a very, very good chance, 99.9%, that they will be virus negative permanently. That is, unless they're at some point re-exposed to the hepatitis C virus. We're going to talk a lot about diet. Diet's very important. Nutrients like magnesium, vitamin E, betaine. There's actually been some very interesting research looking at betaine treating fatty liver disease, alpha-lipoic acid, and N-acetylcysteine as well. And then some botanicals. You'll be familiar with curcumin, epicallocatechin gallate, which is green tea, resveratrol, cordyceps, omega-3 fatty acids, and not least, but last on this list, probiotics, very, very important in integrative treatment of chronic hepatitis C. So, weight loss, let's talk about that just for a second. This was an actual study that was published several years ago looking at people who had non-alcoholic fatty liver disease. Now, this is really important. We're going to segue from the treatment of chronic hepatitis C here to talk about the subset of people with chronic hepatitis C who have non-alcoholic fatty liver disease. It's very epidemic among folks with chronic hepatitis C, particularly those with genotype 3. The virus, that particular genotype, is different than the other genotypes 1, 2, 4, 5, and 6. In that with that particular virus, there's more inflammation in the liver and a much higher risk for non-alcoholic fatty liver disease. So in this particular study, even a mean weight loss of 13 pounds over 3 months, which is very achievable, can improve the parameters or the risk factors like fasting insulin for fatty liver disease. The reason that it's very important to look at diagnose and treat fatty liver disease in those with chronic hepatitis C is that they're at risk for cirrhosis. It increases the risk for progression of the liver disease to cirrhosis. So it's crucial that you know how to diagnose fatty liver in your chronic hepatitis C patients and treat it. Unfortunately, rapid weight loss is not something that we want with chronic hepatitis C, nor do we want that with fatty liver disease. That's very dangerous. And I make a point of talking about this because we're in a time right now where there are, I think, some concerning methods out there for weight loss. One of them is the HCG diet, where people are put on either injections or other forms of human chorionic gonadotropin and given a 500 calorie a day diet. And they can lose significant amounts of weight in a very short period of time. Unfortunately, that's not good for patients with chronic hepatitis C, nor is it good for patients who have chronic hep C and fatty liver disease. That rapid flux or rapid movement of fatty acids, fat tissue breaks down into fatty acids, moving into the liver can cause inflammation, free radical production, and inevitably leads to steatosis, which just basically is the production and storage of fat in the liver, and necroinflammation, which is a necrotic process that leads to fibrosis and cirrhosis. So it's really important that the rate of weight loss in your patients be very conservative, so no more than 1 pound per week for kids and 3.5 pounds per week for adults, which I consider, even that is a little bit fast for my patients.